Hey guys, welcome back. Thank you for tuning in to another video. In today's video, we're going to continue our neck pain pattern series. We're going to go over 3 more muscles in the neck. Although they're located in the neck, these 3 muscles are often the culprits of 3 very common tension headache patterns. The first pattern comes from the sternocleidomastoid muscle. The pattern looks like this. The second pattern comes from the upper trapezius muscle fibers, and it looks something like this. And the third pattern comes from a muscle group called the suboccipitals. And that pain pattern looks something like this. All too often I have people that come into my practice and they complain that they have headaches or migraines a lot. Now headaches can come from a few different things. There are migraines and a lot of people do have them. However, these migraines are often what we call tension headaches. People aren't really aware that the muscles in your neck and spasms in those muscles can actually cause these tension headache patterns. In this video, we're going to go over the anatomy and physiology behind these very common headache patterns. After all of that, I'm going to show you a few ways that you can try and get rid of these headache patterns at home. So the first of these 3 muscles that we're going to go over is the sternocleidomastoid muscle. Now the sternocleidomastoid muscle, or the SCM for short, gets its name from its attachments, or where it attaches on the bony structures in the body. So real quick, just to get a better look at the SCM, if we come in here underneath this platysma, there's a sternocleidomastoid. Looking at it by itself, these red boxes here, the first one, we've got the attachment at the manubrium, or the sternal attachment. Next we've got the clavicular and the insertion all the way back in the temporal region are close to the masseter. The 2 sternocleidomastoid muscles kind of form the V in the front of your neck, right? So sterno meaning the attachment at the sternum or at the breastbone, cleido referring to the clavicular attachment, and mastoid referring to the attachment at the masseter. So if I flex one of these muscles, it's going to help turn my head to the left, and vice versa, right? If I flex this one, it's going to turn my head to the right. If I use both of them together, it's going to kind of help me bring my head forward and down. Very common posture. We like to be on our devices a lot. A lot of us sleep with a pretty thick pillow. We're sleeping all night like this. Or let's say I'm laying on my back and I want to just pick my head up off the floor, right? The SCMs also help me do that. So naturally those muscles can get tight pretty easily. Now looking up from the inferior portion of the skull, we can see that nerve off to the left highlighted in blue. Clearly a cranial nerve. Okay. So again, people come in, they say, oh, I have these migraines. Notice how this nerve literally innervates this muscle. So when inflammatory substances and substances like acetylcholine come in, and they excite the nerve endings in this area, it's going to light up that whole nerve. Okay, now this is a very clear representation of how these muscles can cause headaches. Its blood supply is the superior thyroid artery. A few common scenarios or habits that can cause tension in these muscles is one, working overhead. When we look upward, the SCMs have to lengthen. It's pretty easy to strain them that way if you do that for too long. Or let's say I'm laying on my back, let's say I'm a mechanic, and I'm kind of doing this forward motion to pick my head up off the ground, or especially when I turn sideways, you can see these muscles just standing out with these motions. If you fall asleep on your stomach, right, with your head to one side or the other, right, one of these is going to be shortened. A lot of the time people complain that when they wake up in the morning, they get these headache patterns. And I personally think that's because they're sleeping with 1 or 2 pillows behind their neck. And if you already have problems with these muscles, when you get up and you start to lengthen these by bringing your chin back up, a lot of those patterns can show up as well. Now, good thing about the SCM is it's located right in the front of the neck. It's superficial, meaning that it's above everything else. It's easy to get to. So what I like to do to treat mine is I'll take, either between these 2 fingers or the knuckle and this finger, and I'll use kind of the opposite hand to reach the opposite side. And if you have trouble finding it, just start right here at the sternum and follow that V upward. Another way to help you find it is if you kind of turn your head and bring your ear toward your chest. That thing really stands out, right? So I've got a good hold of that now. Now try and relax that muscle as much as possible. If you get the right trigger point, and if you just pinch on that thing, you'll know you're on it because that headache pattern just lights up, okay? Now, when you find that, just hang out, maybe 30 seconds to a minute at a time each point. You can try and kind of use that muscle or drag this point up and down, pull the muscle away, right? However you can kind of stretch that muscle out. You want to follow these points all the way down. Once you're done with those, then experiment a few fingers outward. See if you can find that clavicular point, right? Usually very tender. And you can just kind of drag that tissue upward, right? Until you feel that other kind of clavicular pattern show up. Work these muscles until they don't feel so tender and try them out when you get those headache patterns, and I bet you'll be able to get rid of them. Real quick before we move on to the next muscle, the one thing that you don't want to pinch on is if you come right next to your jugular, your throat here, you'll feel a pulse in there. Now those are some pretty important blood vessels, so please, don't pinch a pulse in here. You never want to pinch a pulse, okay, in your neck. So start out kind of more towards the ear. Start out towards these more lateral points and work your way down. Now real quick before I go on to our second muscle, if you guys haven't already, please go ahead and take the time to click that like button below the video. And if you guys want to be notified when I post more videos like this, as I'm still building the site, I'm still recording a lot of new content, go ahead and click that subscribe button below. Also, if you guys have any suggestions and you want to see a video on a particular pain pattern, go ahead and leave a comment in the comment section below the video as well. Now the next pain pattern that we're going to talk about comes from the upper trapezius muscle fibers. To take a look at the upper trapezius, we have the entire trapezius, or half of it, highlighted in blue. Notice how those upper fibers insert at that lateral third of the clavicle. They come around the acromion process and along the spine of the scapula. They then span upward and insert all the way up at the occiput, the base of the skull, the back of the neck. They're going to assist the levator scapula with shoulder elevation in most cases. Although the trapezius muscle is kind of considered a back muscle, I decided to add it into this video because of its notorious effect on these headache patterns. Now I've heard other healthcare practitioners refer to this headache pattern as the hook pattern. The pattern's kind of temporal. It comes up the side. Sometimes people talk about a little bit of ear pain or jaw pain that can go with it. So just like the SCM, how you can kind of palpate it and feel around until you feel the pattern show up, same thing for the upper trapezius. Again, I'm going to use my opposite hand to treat the side that I want to work on. Now, I find that it's easier to kind of use these two fingers with this knuckle and my thumb. Maybe some of you would rather pinch it this way, but palpate that muscle, okay? The upper trapezius, like I showed you in the anatomy video, it kind of covers a third of the clavicle, right? Comes around the acromion and up this way. So it sort of rolls forward. It creates, just kind of a roll of muscle in your neck and shoulder area. Now, once you get a good pinch on that point, you really feel that pattern show up, okay? Now, from this point, I can kind of hang out and pinch on it for 30 seconds to a minute or so, just like any other trigger point, and you'll be able to tell when it softens up. But another thing you can do is you can kind of try and pull up this way and unravel that muscle. Some people like to push it back, right? And work their way all the way up to the attachments at the occiput. The upper trapezius is pretty simple, pretty straightforward. It's easy to get to. This one's very, very popular. Once you work on that headache point, you'll find a few other points out more towards the acromion process this way. Try and rub on the points in the back, just below the occiput, and you'll really be able to get rid of that headache pattern as well. Now, to move on to the third muscle group that causes these tension headache patterns, we're going to go over a group of muscle called the suboccipitals. The suboccipital muscles lie pretty deep in the neck, and they're often overlooked by other healthcare practitioners. So on the right side here, I've removed a few layers of muscle to reveal the suboccipitals. Starting towards the midline, we've got rectus capitis posterior minor and major underneath it. Then moving laterally and sort of inferior, we've got obliquus capitis inferior, and coming out to the side from the transverse process of the atlas, or the first vertebra, and up to the occiput, we have obliquus capitis superior. So 4 on each side creates 8. These muscles assist many other layers of muscles in the posterior neck in helping us look upward, or neck extension. The oblique occipital muscles help to stabilize the atlas and its relationship to the bottom of the skull. These muscles are innervated by the suboccipital nerve, highlighted in blue, and their blood supply is the vertebral artery. You've got a total of 8 muscles on both sides together. If we look at one side, we've got the 2 muscles that are kind of more medial. Those are called rectus capitis major and rectus capitis minor. Then if we move laterally, you've got the 2 oblique muscles. They're responsible for oblique motions between the first cervical vertebra and the base of the skull. Now the pattern from these muscles is really temporal. It doesn't give you the hook pattern just like the upper trapezius does, but those patterns can often overlap each other. So it's kind of important just to hit both of them anyway, right? If you use these 2 fingers, come behind that SCM insertion, okay, and dig deep to it. If you poke around in there enough, you'll feel that headache pattern show up that's temporal. Once you find those points, then you can move more medially. I like to sort of look down to kind of open up that space in there. And remember, you have to push through a few other muscle groups, okay? You got to go deep. So you're pushing through the upper trapezius. Use the tips of those fingers. And when you get to that right spot, you'll feel the other portion of that temporal pattern show up. Now, you can dig around and kind of do both sides like this, but the best way to really release that, it's hard to do that just standing up because you're kind of using these muscles to stabilize yourself. You're using them to hold your head up, okay? So the best thing I've seen for those medial suboccipital muscles is one of those little peanut looking things that you put on the floor and you lay on it. It kind of has these 2 little humps on it. I'll put a picture of one here, and I'll see if I can find a good one and leave it in the link in the description box below. But I'd say just lay on one of those things until you feel your headache pattern kind of let you know that you're on the right spot. Just hang out for a minute or so and see if that headache dissipates, all right? All right, guys, that's going to conclude this video. Thanks again for your time. I hope this video can be used as a reference to help you guys with these headache patterns at home. Again, if you've tried all this stuff at home and you're still struggling, if you're located near me or in the area, go ahead and click on the link to my website in the description box below this video. Book a session with me online and I'd be happy to help you out. Thanks again, and I'll see you guys in the next video.